Welcome to Adapt NCLEX Signs of Pregnancy, Probable, Presumptive, Positive signs. These are high yield that shows up all the time. For no reason, you got to know them. This video, 12 questions, will make it easy. Stick around, keep track of your score, and let me know. NCLEX Practice question on Maternity NCLEX question. First question. This finding corresponds to which sign? During a bimanual exams, pelvic exams, the next note, asymmetrical, that's the buzzword. The best way to answer these signs of pregnancy questions is to go for the buzzword. Asymmetrical enlargement of the uterus, 1. And a soft area in the mid of the lower abdomen, 2. These findings correspond to that. Piskacek sign, Ladin Sign, Chadwick sign, Hegar sign, Ballottement and Quickening, Hegar sign and Chadwick. Think about it. This is specific, asymmetrical enlargement of the uterus in the mid-lower abdomen. What do you think? You know, Chadwick is blurry discoloration, therefore B and D is gone. Ballottement is the movement of the baby, and a quickening is what? The feeling, flutter feeling. That tell you, Ladin sign is for what? The midline of the lower uterus, anterior portion of it, and Piskacek sign is associated with the word asymmetrical enlargement of the uterus. This is your right answer. Did you get it? If not, stop the video, go back, look at the explanation, try to know it. Next time when you see it, you'll master it. And this is the concept. Which of the following are considered probable sign, right? And this is assessing the client who is 6 weeks. Select or apply. SATA question. Maternity nursing. Positive on pregnancy test. Chadwick sign, bluish discoloration of the cervix, nausea or vomiting, ballottement, and quickening. The best way is to rewrite the question. Probable sign, it means what? What does that mean? It's a vital sign. The probable sign is a vital sign. If you check pregnancy test, yeah, that tells you pregnant. If you do a physical exam and you see bluish discoloration, that's good. Nausea, vomiting, mother saying it, so that's presumptive. Ballottement, the same thing, is on physical exams. And the feeling of the baby moving is what? Presumptive. So these are your right answer. 2 down. What is your score? Keep track of it. And this is performing intake history for a client at the OB. Which of the following are presumptive signs of pregnancy? We talk about it. Presumptive. That means the mother is telling you, mother complaint. Amenorrhea, breast tenderness, fetal heart tone detected by the Doppler, urine frequency, and Hegar sign. What do you think? If I tell you I don't have menses, that's presumptive. If my breast hurt, it's presumptive. This, if you can see it, no, it's not presumptive. Urinary, that's vital signs. Urinary frequency is mother talking about it. Hegar signs, physical exams. Therefore, these are your right answers. Number 4, a client asks the nurse, how would I know I'm really pregnant? How do you know? Is it probable, presumptive, or positive? Feeling nauseated and tired, confirm pregnancy. Home pregnancy test can't be trusted at all. Hearing the fetal heart tone with Doppler is a definitive sign. Quickening is the only sure sign of pregnancy. Quickening is usually you have a feeling, but positive sign is always the best way. And let's note bluish discoloration of a client's cervix during pelvic exams. What do you think? You have to know the definition of all of them so that when they ask you a question, you know it. Bluish discoloration, we saw it already, is usually Chadwick. Hegar sign is a softening of the cervix. And Hegar sign is a compressivity of the uterus, and the ballottement, baby just jumping up and down. These questions are straightforward in terms of pregnancy signs because there's nothing they can ask you, but don't let them take the point away. You just have to be like really consistent and know in your mind. During perinatal exams, the nurse palpates the lower uterus and feel there's a softening. Right? Softening, that's the key word. It's the buzzword. Softening of the uterus isthmus. The finding is called what? When there's a softening, that's what? The Hegar sign, right? That's the big thing. Chadwick is the Blurry discoloration, very, very important. And the Godel is the compressibility of that. 16 weeks, report flattering sensation in the lower abdomen. That's what she said. So that's what presumptive. We can answer choice that are presumptive. Chadwick, Goodell, this is it. Huntment, Chadwick, and Goodell are all what? Probable sign. This is quickening. It's presumptive. Which finding is considered a positive sign of pregnancy? That means I have to see a baby inside you. Amenorrhea, that's you telling me. Pregnancy test is not specific. I hear baby heart. Excellent. Your breast is enlarged. No, so this is good. And this is teaching a client about early signs of pregnancy, right? Which of the following indicate correct understanding? Which one is early signs? I may feel more tired than usual. Excellent. My breast might feel tender and swollen. Good. My cervix will become bluish. Yeah. The only way to know is through ultrasound. No, there's so many positive signs. You don't need to do ultrasound. I may notice a flattering feeling in my belly. Quickening. Excellent. What is your score so far? As you can see, question 10, 3 more. A client presents with a mixed period, nausea, urinary frequency. This is what they complain about. So you got to make the question readable, easy for you. If they're complaining, it cannot be diagnostic, presumptive, probable, and positive. What should it be? They're telling you. If they're telling you, presumptive, probable. During the biomanual exams, the nurse note the soft area of the midline of the lower midline is the basket of the uterus. If the lower midline, it cannot be Chadwick because it's not bluish. It cannot be Hegar sign because it's not the softening of the cervix. It cannot be Ballottement because the baby is just not moving. This is Ladin Sign. And the last one. And it's assess the client to report mixed period, telling you for 2 months. Client report nausea, breast tenderness, fatigue. Those are all what? They're telling you presumptive sign. During exams, the provider note bluish. That's what? It's probable sign. Asymmetrical enlargement of the uterus, probable sign. Fetal heart are not yet detected, so there's no positive sign. Which of the following represent probable sign of the pregnancy? What do you think? Blurry discoloration, that's that. Breast tenderness is what? Presumptive. Asymmetrical enlargement of the uterus, probable. Fatigue, presumptive. Mixed period, presumptive. These are that NCLEX. 12 question, straightforward, knowing the content associated with probable, presumptive, and positive signs of pregnancy. This is Maternity NCLEX Questions, NCLEX Practice question to master your content. If you like this video, the next video that is coming is associated with this. You can watch it and know more content like that. And if this video helped you, subscribe to Adapt NCLEX for this content. Take care of yourself and good luck.